This podcast is for educational purposes only. Please consult your doctor before changing any medical care. This information, products, or comments contained within this podcast is not approved by the FDA for the treatment or diagnosis of any disease. Although we attempt to keep the information up to date and current, we cannot guarantee the information is up to date at the time of this recording. Individual results will vary. No one should expect the outcomes or results mentioned or described in this podcast. Health shares do not constitute health insurance and do not provide a guarantee to pay for your medical bills. Please consult your broker, general counsel, and/or doctor before changing your healthcare plan. Envita and Envita Health makes no guarantees for outcomes and results. Thank you for joining me. I'm Dr. Dino Prato, founder of Envita Medical Centers and CEO. Dr. John Oertle, who works with me and also is one of the chief medical directors at Envita Medical Center and on the R&D side. So this next question we have is, does insurance cover Envita and what's the cost of care at Envita? So I'm going to start with saying our actuarial data, which was done by a third-party group in just 2020, it shows that we're 50% the cost of conventional oncology. And then I can tell you it's 10 times the precision targeting for that. So you're getting an incredible difference between the cost and the technology access. And so we're 50% the cost of oncology with much, much more precision than you would see in oncology. And the cost of care will depend on how advanced the disease is, right? If somebody has an earlier stage disease, it could be much easier, less involved. As they have a more metastatic and complicated disease, there's need more for immunotherapy and other treatments. So John, I'll have you kind of share with this a little bit your thoughts as people are asking the question, what's the cost of care and does insurance cover? You might get into some of the limitations with CPT codes and how some of our patients after Envita, they use third-party billing to try to help get reimbursement.
Yeah, absolutely. I mean, I just want to reiterate again, 50% the cost of conventional oncology with at least 10 times the technology, at least. And then the Envita results and the outcomes to be able to actually continue to be able to move forward. I love this. It's not cheap, but it's valuable. And I think that's really important. Now, the other aspect of the ability to be able to get insurance reimbursement, there's sometimes patients do get insurance reimbursement on Envita Care. And it's not all the time, but they do. They can get third-party insurance reimbursements. But the other thing that I really am excited about as well is the fact that employer groups that have self-funded insurance plans are covering the Envita Center of Excellence to be able to send their cancer patients to Envita. Why? Because CFOs and the HR representatives are seeing that there's better outcomes, better experience because of the technology that we deliver, and it's a cheaper cost overall to conventional oncology.
Well, let's talk about this for a minute. Oncology is the most expensive healthcare cost, right, that people are going to see. In fact, we've written some articles. We will look at those. You can get oncology programs that go well over $1 million for late-stage cancer. But people say, well, my insurance will cover it. But the problem that people don't understand, and I say this because...
Hold on, can I just share this, Dino? Because again, it's even late stage oncology care that even ends up costing over $1 million. It is for vanilla, vanilla standard of care. It depends on if you're really complex, the cost goes up, but it's nothing that's unfortunately, it's not life changing. It's not life saving. The kind of care, it's palliative care.
Yeah,
they talk about it, palliative care, which is I'm just going to give you the standard, the very basic. And even with that very basic level, it still is costing a significant amount to either an insurance company or self-funded plan.
Well, here's an example I can help people kind of get an idea. We did a case for a group. It's just a census. It was a census so we could, because we're building the Envita Health Plan, which is coming out this year, which will actually cover precision oncology for, as we're doing now for employer groups, but for even some health shares and others where they get full coverage and they get access to this technology and actually precision in primary care, and they get it all across the platform. They have access to conventional, integrative specialists. We have quality scores. That's a whole nother conversation. So that's our Envita Health, but we have a lot of knowledge in this space. We were given a census. It was a patient with a stage 2, 3 breast cancer that was being sent from a rural region to a more of a city hospital, well-known hospital.
Mhm.
That hospital had calculated about 380,000 in chemotherapy. And when you and I know
For the
I look
first year. For the
for
first year.
for that year, that for only that year, which was this year of 2023, they had quoted 380,000, and they expected that the patient might come in and out of the hospital. So the total cost the insurance company allotted for that person was $550,000. Now, no precision, no targeting, vanilla NCCN guideline care. And here was what the problem was with that. If you understand that, is that when you really look at what the hospital was doing in the treatment of this patient, it was I I believe the care to be based on the precision we offer here at Envita, archaic. And I don't want to be disrespectful, but it is so outdated because the patient had failed first line, they're going into second line care. It's plug and chug. No precision targeting, no immunotherapy, no image guided precision treatment. None. It's just treatment. The likelihood of that patient failing that care is incredibly high, right? And so we know now.
So much so that the failure rate is so high that the insurance company had already calculated the costs for these consecutive years, which continue to escalate
That's right.
by the year because they know that the actual failure rate is going to be it's almost a guarantee.
That's right. And when you looked at Envita's care, it was half or less than half of that for 10 times the technology. So there's the concept of the care, and we've been working really hard to help patients get covered, but we're not in charge of these large insurance companies, and they're slow to adopt technology for a number of reasons. Maybe they're trying to calculate risk, or insurance companies are they're financial institutions. They're not really healthcare. They don't really look at outcomes and all that. They're businesses that collect money and invest in real estate or other stuff. They're financial institutions. I mean, if you look at the BUCAs, the Blue Cross, United, Cigna, Aetnas of the world, these are investment, financial firms, really, if you look at how they operate. When you look at all these cancer centers, they're handcuffed because they're operating in those limited guidelines. And our patients who've already failed care coming to us, we have to have the technology that we believe to be 7 and 10 years ahead so we can help them respond. So if we just offered standard of care, we would just be standard, and we'd have, yes, probably many times more patients. We get something like over 13,000 patient inquiries a year and growing. And with the self-funded healthcare, employer groups growing, people wanting this kind of care, but their employer, it's a good thing to talk to them because your employer can cover your care in their plan because the rate is less expensive, the technology is better, and every insurance company is different. But understand that they're slow to adopting technology. Our patients don't have the time to wait to play that game, covered, not covered, and then start care. No, we have to treat our patients. And when you look at patients, then after care, we'll go to third-party billing companies, independent from us, and try to submit some of it through different submitting and get back 30%, 40%. It just depends on their insurance. It depends on their policy, which is insurance is so non-transparent. I don't want to even get into this. People don't know what's covered, to what extent it's covered. It's kind of like a hidden layer, right? Deductible, this, that, this is covered, out of network. It depends on your policy. And unfortunately, today, when people say I have good insurance, what they're saying is they have a low deductible. So I go back to saying all insurance is access to care, whether it's Medicare or it's Blue Cross, BlueCa, Blue Cross, United, Cigna, whatever. It's access to care. It doesn't mean by any means the cost of your deductible doesn't mean you're getting the best technology in the world to save and extend your life. That's what Envita's focus is, right? And that's actually how we're working on building our plans. And I think there's a lot of excitement around people getting precision care, integrative care, the best of conventional, the best of integrative medicine, customized for them for not even to go into preventative medicine. That isn't even covered in anybody's plan. I mean, they don't even do it well. That's a whole nother conversation. So the idea is, what's the cost of Envita care? It depends on the cancer, the stage. And if you talk to, we have patient care coordinators, others on the team that can kind of give them rough estimates, but it depends on the complexity of the cancer. And when you understand we're 50% the cost of conventional care, that's amazing. And the difficulty remains, well, it's not covered. So oftentimes you're paying out of pocket and then you're billing or trying to get something back from your insurance company or using a life insurance plan where you have part of it that you can use to help with a terminal illness benefit, or patients are raising money. I mean, we've been doing this for 23 years. I can tell you we have done our best to help patients. But if we just, as an organization, continue to work to educate insurance companies on the benefit of precision oncology, which is slow coming, but it's coming. And just now they're starting to accept certain things, but it's going to grow over time. That's going to make the biggest difference. And that's really the design of our healthcare plan, for a different conversation, where we're helping people get in a plan that if they do get cancer, they have coverage. So did we answer the question of exactly what the cost of care is? No, because we don't know what the stage, type,
Specifics.
complexity is, right? So, we can only give an outline of of our approach and understanding of that insurance model.
Yeah, I have one more thing to add because I think about this from a medical insurance and medical industry. You said insurance is not transparent. Hospitals, doctors' offices are not transparent. And what you actually see is that you go to the doctor's office, you don't even know what the cost of any care is. It's not like going to the grocery store and picking up, say for instance, a stick of gum, where you know exactly what that cost is. At Envita, our patient care coordinators try to be able to actually give an estimate, but it's really once you actually meet with the doctor, once you actually develop a plan that's designed around your specific case, then you actually get your understanding and your quote as far as how much that care is going to cost. That doesn't happen in almost any institution nationwide. If you ask what is the actual cost of care, they say, I'm sorry, I don't know. I can't provide that to you. And so it's one of these areas where there's such lack transparency that really they don't want to share with you that good faith estimate. And there's actually laws. There's actually laws that have passed that actually require doctors to give a good faith estimate, and they're still not even giving it. And so it's an unfortunate thing, but it is. The cost of oncology is skyrocket as far as that goes. It's a very expensive because there's a lot of care that's demanded from patients in oncology. But it's, again, one of these areas where Envita, the transparency is there, and we want to be most accurate and detailed with those specifics after your appointment with the
And
Envita doctor.
once you know what your specific needs are, right, and you have your plan built just for you, for your genomics, immunotherapy, all those customizations we've talked about, then you have an itemized list of exactly the cost, and the doctor who doesn't give you guarantees on your outcome. The transparency of Envita has been the focus too of us working with patients, because we know that, a lot of these institutions, you don't know this stuff. It's kind of a hidden, you don't know the cost, you don't know. Ours is transparent, and then the patient can decide what they want to do. And I have to say, the majority, in the high 90 percentile of patients that come to Envita, tell us, I wish I would have came there first, or I would have gotten here sooner, because they immediately see the advantage of this precision targeting, right? So anyways, that's the best way we can answer that question, in the sense that every patient's cancer is different. Once we have that data, they can get an itemized, detailed cost breakdown. Our patient care coordinators try to give them estimates, but it's hard because until we get a lot of that data back, we don't know how advanced, how progressed. There's a lot of pieces we use there. Then the plan is built, and then the cost is reviewed with the patient. And we're working to get insurance to cover it. I mean, that's why we're building our Envita Health, and later this year to be released, which is self-funded employer group plans, health share plans, helping families, communities who are interested in better technology and access to that for them and their family. So thank you for joining us. I know this, to get a specific information for your cancer, speak to a patient care coordinator, and then even better, if you can, and we have the availability, come on in and get your workup done so you can get specific itemized costs and go from there. But also see the technology that you're missing, because you will see that in the technology we offer is many times ahead of what you see in conventional care. May God bless you on your journey to healing. I hope this information was helpful. John, thank you for joining me. And we wish you guys all the best. And we will be continuing with more Q&As on helping answer the most common questions.